Do you mind just telling the listeners, what does pediatrics involve? What is for people who don't know what it is? Do you mind just giving more details on that?
So, pediatrics involves taking care of children, just not taking care of adults from the age of basically from birth. And then for some practices and in some institutions, they take care of kids all the way from birth up till 18 years. For some, it may be 21 years. A few practices, especially if, they're dealing with children with chronic medical conditions, may actually take care of them for longer, like up till age 25 or so. We're pediatricians, we are like parents, we don't want to let go. So some of us keep our kids, especially those who have chronic medical conditions, longer. If you're a primary care pediatrician, you're really responsible for making sure that they grow up healthy, monitoring their growth and developmental milestone, anticipatory guidance, those kinds of things. Those are what you do, immunizations, etc.
Okay.
And then for me, I chose to do a subspecialty. My subspecialty, as you mentioned earlier, is pediatric infectious diseases. So I did a lot of primary care throughout my career, and I still actually do some inpatient general peds, hospital medicine type of work. But my main clinical work is really pediatric infectious diseases. So that basically taking care of children with all kinds of infections and infectious diseases, simple, uncomplicated infections to very complicated. One of the things I also do is take care of children with which thankfully now, because of the advances and all the research that has been done, we don't see too much now, but HIV infection, which especially for babies is something that they would acquire from their mother. So that's one of my areas of specialty also within PID. But then I take care of kids with pretty much TB and all kinds of hospital acquired infections, then immunocompromised hosts get if they have weakened immune systems due to cancer and maybe some medications that they are on, and then the simple bread and butter infections that we all get.